So here's the agenda. We've got Sam Walters doing the roadmap update first because she's got to zoom off to something else. And then we will have Anna Hartley, as usual, talking about our COVID update. We've got a vaccine update from Darsha from the CCG, and hopefully we'll be able to have enough time to play a Spectrum People video. So without further ado, Sam Walters, over to you, please.
Thank you, Tracy, and hi everybody. So I know it's a while ago since I last went through where we are, and clearly a few things have moved on. We did expect some changes earlier on in June. However, we are here on the 30th of June and there are still some restrictions in place. What I've done there on that link there below, that is a link to some general guidance there for everybody really, and it's been simplified so it goes through quite a lot of detail if anybody's wanting any further detail after the meeting. It's just a quick whistle stop tour really through where we are, what's different to what I've gone through before. Next slide please, Tracy. So basically, the amendments that are in place at the moment is that there's now no limit on the number of people who can go to a funeral. However, there are caveats to that, and it will depend on how many people can be safe wherever the funeral's taking place. So, for example, our crematoriums, due to the spacing and the ventilation and the seating arrangements, there are still natural limited capacities because obviously we've got to keep people safe within those venues. It's the same for weddings. Weddings can go ahead. However, there are some limitations on there that you can have up to 30 people. And basically what you have to make sure is there's still social distancing in place at those events. Next slide, please. So this is one of the things that you may have seen in the news a couple of weeks ago. But there are some instructions for certain parts of England. Now, at this moment in time in Wakefield, we haven't been necessarily told that this is an additional measure for us, but it's something that I did want to bring to attention because in some areas where there are high infection rates, there is an extra care, an extra strong guidance that's put out by the government. And that is in those areas about you should meet outside rather than inside, which goes against actually what the national restrictions are at the moment. And you can see there, I'm sure you can all read through that. You should keep 2 meters away, etc. And carry on from working from home. And the general instructions are here. You should get tested twice a week during using a lateral flow test. Stay indoors away if it tests positive. You should stay indoors away from other people and arrange to have a PCR test. This is all on the government website at the moment, but it's subject to change and does keep changing each day. I did see something about weddings outside. Now there is some real detailed guidance on weddings and it's very hard to articulate it just in a couple of words. So what I can do following the meeting is send that information through that link to Tracy and give you that information for that comment in the chat. Next slide, please. So businesses and venues. So basically what's happened is we've moved now to being allowed to go back indoors. However, those going back indoors, there are limitations. So just as there was when it was just outdoors that were open, the indoors now require that it's groups of up to 6 people or 2 households. And you can go to outdoor venues in groups of up to 30, but again, in those groups, there should still be some form of social distancing in place. If you're outside, you can go inside to the toilet or to pay. And if you are inside, you must eat and drink whilst seated. If there is alcohol served on the premises, whether you're outdoors or indoors, it is table service only. So even if you're going into that premises and just having something non-alcoholic to drink and eat, if the premises serves alcohol, it must be table service, and you should wear your face covering whenever you're stood up and walking around until you sat down at your table ready to eat and drink. And you will see also the changes that's been since I last was speaking to everybody, that indoor places such as bingo halls, bowling alleys, casinos, cinemas have reopened, again with restricted numbers and social distancing and risk assessment in place. There are some places that must remain closed, and that includes nightclubs, and obviously the restrictions remain in place for anything that is open for those requirements that I've just mentioned there. Next slide, please. Okay, so this is really, it is a real quick whistle-stop tour, but the guidance is being updated as we move along, and it is there. The link there that I've put on the slide is the one that you should go to look for the most up-to-date. Some of the activities with COVID measures. So again, Val, I think what I would say on that is it all depends on the size of your groups, where it's going to be held, and the numbers, because again, we will look at ventilation. The indications that we're getting from government is that on the 19th of July, these restrictions will be lifted. However, I am going to say with some caveat, because behind the scenes we are being given some information that the QR codes that I have mentioned before will remain in place until at least September, and potentially there may be a need for more local area restrictions depending on where your current levels are. So where the government may come out and say everything, and it depends on what the dates are, where the government may come out and say there are, all restrictions are off, there may be some limitations if we are in a high infection area. Again, I think probably with those two questions, I can pull down through the guidance, because I appreciate it's really difficult to have a look through, and I will pull down and get those specifics to you. Tracy, would you mind sending me those questions after the meeting, and I'll make sure that they get answered. Any other questions? Sorry, you're on mute, Tracy.
Sorry, yes, I will.
Thank you. So that's me done with, hopefully.
Thank you very much, Sam. Any questions for Sam? No, I think we'll let you go then. Thank you so much for giving your time up this morning, Sam. I know how very busy you are. Thank you so much.
No problem. Take care, everyone. Thanks. Bye.
Thank you, love. Bye. And now we've got Anna Hartley, our Director of Public Health, who will go through the intelligence.
Thanks, Tracy. Just want to go on to the next slide. Yeah, so as you all know, we've got numbers going back up in the district now, which I think was the same as last week, but we are seeing them rise really quickly, and that's for two reasons. One, we obviously have infection rates rising, but secondly, we're working incredibly hard to find all those positive cases and give them a test, and you'll be aware that we've got teams going out door knocking, etc., to kind of pick those people up and ensure they get tested. So unsurprisingly, our numbers are going up. So next slide, please, Tracy. So I've included this is sort of hot off the press today. The grey line is the validated data, and then the two columns after that are data that hasn't been validated and may change. But I always look at it because it tends to be more or less accurate. So if you look at what's happening in Wakefield, we've gone from 118 on the 20th, and by the 26th, we're rather terrifyingly at 276.5 per 100,000, which I think slightly touches on the questions that we've had in the chat so far, which is that that of course certain things are permitted, and if people have had 2 vaccinations and had a couple of weeks to create that immune response, then in theory, you can within the guidance kind of be doing more sociable things. However, given how high those rates are, you might want to think about your individual risk and the risk of any groups that you work with, and potentially hold off for a few more weeks, just basically to reduce your risk. Because what we do know is, whilst the vaccine is incredibly effective, there's always going to be a few people that the vaccine doesn't work for, and we have had the odd case where people have had COVID despite being double vaccinated, and that also we know there are still people within our communities who for whatever reason haven't had the vaccine. That those numbers are likely to continue to rise as well for the next few weeks. So on the 19th of July, they're likely, looking into my crystal ball, given all those factors, to be a bit higher than they are now. And then once on the 19th of July, we feel fairly confident that they will adhere to what they've agreed, the government, around dropping nearly all of the kind of all of the restrictions. We are likely to see that go up again. So that will be slightly limited by, obviously, if a lot of a high percentage of 18 pluses have all had the vaccine, that will put a bit of a break on that, plus potentially schools going on, going on holidays. But just to warn you that I think these numbers are going to get higher before they get lower again. So next slide, please. So again, you can see that, as you know, most of our tests and most of our infection rates are in that younger age group, and that's demonstrated clearly by that 11 to 16 line. Next slide, please. Realise I do need to be quite quick today because we've got a lot to get through. So again, this is a really good slide, just shows you really clearly where those really high rates are. We're not seeing it in our 80 pluses. What we are seeing is that in that younger age group up to about 24 who are being vaccinated. And I think in Wakefield, I think we had a Darcy, you'll nod or Emma, nod or straight your head, but I think it was a 12% increase in vaccinations in this group last week, which was the highest vaccination increase across the whole of West Yorkshire, way above our neighbours. So we are getting those people vaccinated, but you can see from those numbers, very high numbers, that however, feel more sorry for Leeds, where one ward in Leeds I think is 1,600 per 100,000, so we're not there either. Next slide, please. So again, you can just see that there's no particular sort of high area. We're just seeing that widespread community transmission. The 5 areas that have been chosen to do the additional door knocking do have slightly higher levels of infection and also lower levels of vaccination, and that's why they've been chosen. Next slide, please. So yeah, I'm just showing where those kind of hot spots are, and you can see that's moved around. That red spot was over Kirklees, and now it's over Leeds, so where I live. So I'm not going to the pub. I'm definitely not going to the pub at the moment because I really don't want to catch COVID. Next slide, please. So again, just to show you a bit, but we just keep an eye on our neighbours. Leeds context, you can see extremely high in that younger age group. Next slide, please. So common exposure events, again, you can see that the common exposure is education. However, that doesn't mean that children and young people are becoming positive in education. Actually, I think a lot of that transmission is happening outside of the school setting, but it's just that's where they've been identified as being the 7 days before, or 2 to 7 days before they become infected. Next slide, please. But our hospital admissions still remain really low. The blue line is Wakefield residents, so we're seeing about 6 Wakefield residents in hospital from COVID. There are a number of people in hospital at the moment who've had COVID tests who may come back as positive, in which case we'd expect to see that start to go up. And what we're hearing from other areas of the country is admissions, inevitably, when this many people have got COVID, you will see those admissions start to go up, but deaths are still remaining incredibly low. Next slide, please. Which again is indicated by this slide, 0 deaths for another week. So that's really positive and testament really to the fact the vaccination campaign is working. Next slide, please, Tracy. Yeah, I think that's it. So yes, I shall hand over to my next presenter.
Thank you. So this slide just gives a quick overview of the numbers that we've done. So we're looking at about 9 in 10 people over 50 have had now both doses, and as Anna and colleagues have been saying, we are doing a lot of work around attracting 18 pluses. So we just wanted to highlight some of the initiatives. Tracy, could I have the second slide, please? Thank you. So you might have seen this this pop up in the WhatsApp group or on social media, but it's been Grab a Jab weekend. And we've been promoting walking clinics across the area, and that's been for first and second doses. And we're going to go on to the next slide in terms of the clinics that you have. So over the weekend, from Friday to Sunday, Navigation Walk as one of our centres carried out about 433 vaccinations. And Boots in the riding centre did 97, and we're just keeping an eye on the figures, and it's been great that people were coming through. What we have had is feedback from the community that it would be really useful to know not only where clinics are running on which days and what times, but also which vaccine is carried, so you can plan first or second appointments. Because for anyone who had AstraZeneca for first appointment will need to have the same vaccine for their second. So this slide shows what's coming up. There are some clinics today and tomorrow. If anyone hasn't had it, it's an opportunity today. So please share. Information is on our website, which was on the previous slide. So you will have access to the information You may have heard in national news that there is a central website with a link. That link, unfortunately, isn't very functional at this moment. So all information around Wakefield walk-in clinics for vaccination are on the CCG website. Could I have the next one, Tracy, please? This is just a summary of how it's working and what to expect. So it's for first and second vaccinations, but it is on a first come first served basis. One of the things we have agreed to do is, should there be such a situation where where supplies effectively we've been used up, where clinics need to close, we will send a WhatsApp group. So if you are on the WhatsApp circulation list for the COVID Community Champions, you will get to hear from us, as well as the social media. And the next one, Tracy, please. Few which may be useful for sharing within your groups and onwards. Few social media adverts have been prepared for those who are under 30, so feel free to adapt and share these as you find appropriate. And the last one. In the past, we've shared community conversations briefings. If you do come across any questions that you find from the community, we have updated it. Now we are on version 7 and you can access it on this link. So hopefully that's useful. Thank you.
Thank you very much, Darsha. Has anybody got any questions for Darsha about her presentation? I think we might have time then, Anna. We were hoping to show a short video that Spectrum people have made. Unfortunately, they can't make the meeting today, but wanted to share this short video that was made in partnership with Coactive and some young people from Agbrig. It's on YouTube and they're asking people to please share if they're able to. It was funded from our Live Well service, and there's a link on there for the video, and hopefully Anna, our whiz kid on the is going to play it for us.
That whiz kid might be a bit strong, but anyway, yeah, let's give it a go. Let's see if we can do it. Here we are.
Shall I stop sharing my screen? Oh, there we go.
Yeah, it didn't give me that sound thing, so let's just tell me if the sound works.
That you get scared of. So a fear, like for the COVID vaccine, when they put a needle in your arm, that might scare you because it might hurt a lot. And then if you take the vaccine and just try to not be afraid.
Ask an adult that already got the vaccine, so you don't feel as scared as you did before, because they know how it feels, so then you'll feel less scared about it.
So you don't need to be scared about it.
A lot of adults have said that there's microchips in the vaccines which will be tracking them, and I personally think that's not true, because if there was a microchip, then you'd be informed about it, and it's just not appropriate to think stuff like that because of all the hard work that the people who have made the vaccine.
Facts are something that is actually real.
If you take the vaccine, then there's more chance of you not dying.
You have the COVID vaccination, and it goes on top of your arm. Your arm might hurt for a few days.
The more people who take the vaccine, the more safer we'll be. If you take the vaccine, then you have, like say, you can probably see more people. You have to wear a mask.
It'll be healthier and no COVID, hopefully, and everyone's going to be happy. But then it's going to be sad because before the vaccine, some people die. From me, my uncle died from it, and it was quite sad. And I know other people, their grandmas, parents, if everyone took the vaccines, because right now there is a lot of people who are taking it, but then there's some people who are scared about it, and there's some people who have a fear of injections. But then you got to realize that that injection is going to help you and save you.
Keep us safe and get the vaccine. Keep us safe and do the vaccine. Keep us safe, take the vaccine.
Take the vaccine for me and you.
COVID freedom!
Wow, that was great. Thank you very much, Anna, for sharing that. That's a lovely video. And I can recommend Apple Tree Allotment. It's a lovely environment to go if you get the chance. I don't know if we've got anyone on the call from Lindsay. I don't know if you know from Recovery College, but there was a short course for people who might have a needle phobia. I don't know if it was Turning Point or Lindsay, was it you?
Yeah, it was with Turning Point. So you can either get in touch directly with them, or if enough people want to do it, if people come to us and let us know, they can run one directly through the Recovery College as well. So either option is fine.
Fabulous. Thank you very much. That's really useful to know. We did have some questions for our panel, and the first is, actually I think it's from us, from our public health team. Are any of you champions aware of any hesitancy in vaccine uptake from young adults? If you've had any feedback about young adults that are hesitant to take the vaccine, and if so, why? It would be really good to hear that information from you, please, so that we can look at our communications and see if there's anything that we can do to support people to understand that the vaccine is a positive thing for them to take, and to help them to understand and to take the vaccine. So if any of you have got any information. Oh, we've got something from Amy there. Our next needle phobia workshop is running on the 14th of July. Thank you for that, Amy. And if any of you do have any information as to why young people, young adults may be hesitant, if you could please let us know. Thank you. The next question was, where is the Moderna vaccine being delivered? And Darsha, I've just stuck on there, Elland Road at Leeds is the only one in West Yorkshire at the moment. Is that still correct?
It is, yes, at the moment it is.
Thank you. And then a question about how is the doorstep surge testing actually being done? Who can we expect knocking on the door? Will it be the police in riot gear? Only joking. We'll have to edit that out. Will they be testing you on the doorstep, or just inviting you to attend locally? And then specifying areas. I think we've just said like Pontefract North and Wakefield North, and we've had some feedback to say it would be really useful to know which towns these are in. So if we could have someone to answer that multifaceted question, please. Emma?
Yeah, that's me. So Wakefield is in an area of surge testing, but we're also providing enhanced support. So we're also providing information to residents around the vaccination programme, around the isolation appointments and other welfare information as well, in terms of medications and shopping and where else people can get help, as well as the promoting the message around getting tested. So presently we're asking any of our residents within the Wakefield district to have a PCR test. You don't have to have symptoms to get tested, and you don't need an appointment. You can just walk up to the testing site and the MTUs and have an appointment for a PCR test there, and then. There will be the paperwork that you'll need to do as part of that, but that's routine. We wouldn't advise anyone that's tested positive for COVID in the last 90 days to have a PCR test there, so we're not asking them to come forward for testing. The reason we're trying to ask people to come forward to testing is that we know 1 in 3 people actually have COVID, but they don't know that they have symptoms. And allowing us identify people that maybe fit that sort of criteria in terms of you not knowing that you've got COVID because you don't have any symptoms, which is perfectly normal, means that then you will become aware of your COVID infection and you will be able to isolate, and then we will be able to help identify your contacts, who then will be able to isolate, which will then mean that we will be able to bring down the COVID infection rates within Yorkshire. So that's really the rationale for trying and do more testing. We won't be testing people on the door. It's something that we didn't want to take forward. If members of the community do think that's a a good idea as part of this approach, then certainly we could consider that as part of that. Who will be knocking on the door? So largely it's people directly employed by the council as leisure service staff. We have some COVID marshal staff, we have our testing staff. We have a great army of volunteers that are all largely council employed, who have had a training on all of this sort of testing, self-isolation information and sort of the approach, that will be having that conversation as part of the process. When they do knock on your door, if you're in one of these areas, they will also ask you to do a doorstep survey. And we'd really like to encourage people to participate in that, because that's really giving us some real information about how people are feeling about testing, how people are feeling about vaccination program, and just generally how you're feeling all about COVID. And that's your opportunity to give us that personal reflection as well. So we'd really encourage that. I'm trying to think what else I need to cover. Tracy, do you want to provide me with another prompt?
Specific areas like North, Pontefract and Wakefield North, could you give the towns?
Yeah, so we're not actually focusing naturally on towns. We've got postcodal areas within Pontefract North and Pontefract South. So I think after the meeting, Tracy, what might be helpful is for us to share those postcodes, because as good as my memory is, I haven't got them all in my mind. So we could do that after, and we are going to promote that as well in part of our comms strategy, and working with the media to put that in the papers and stuff, so people know which postcodal areas we're focusing on. But that was just where there's that extra support around those that particularly may haven't participated in the vaccine program, but the offer is to everyone across the district via different channels.
Thank you very much, Emma. We have a question from Pam. Is there any news yet on whether it's likely to be possible to give a third boost jab if needed at the same time as flu? And Dash has responded in the chat, for those who might not be able to see it, to say that this is still under consideration, and when we know more details then we will update. And Coach Paul has very kindly put there about the young adults that there's some complacency that seems to be the sticking point with young people that they've spoken to in the southeast of the district. Because older groups are taking the vaccine, they don't see a great need to take it themselves. So thank you very much for that feedback, Coach Paul. And Sarah Deakins asked, where in the district can someone obtain a PCR test, please? I don't know if we've had a response in the chat.
I think Darcia's posted the link to the where you can get tested.
Has she? Brilliant. Thank you very much, which we'll share with the notes. I think that's all from the chat, unless I've missed anything. So I think that's all from us for this time, unless we have any last minute questions or comments.
I've got a last minute thank you to everyone, and just a reminder, if you're sharing things on social media, videos or your own campaigns, and there's some great campaigns that some of our community groups are running at the moment, if you share it on the WhatsApp group, then other people will be able to share it far and wide as well. So I'd just like to encourage you to do that and just keep the momentum going. Thanks very much, everyone.
Thank you very much. Thank you to all our speakers and everyone for attending, and please do help to share those messages that you've heard today. Thank you very much. See you next time.